So my speech is today about the rules, which are exactly the golden rules to improve the diagnosis and especially the microbiological diagnosis in prosthetic joint replacement. So these are my disclosure. In the last 2 years, I received grants and royalty from this company. Let's start with this interesting, let's say, excursus about the how to make simple the diagnosis. Firstly, I think it's important the kind of a relationship you have with the orthopedics, and especially which kind of the relationship the orthopedics have with the clinical lab. So I mean that both they must stay in strict contact to apply to be compliant with the best practice to define exactly which is and how to diagnose the prosthetic joint infections. That's why a few years ago we started this adventure, very challenging, because we checked at that time at least 87 different references. We involved several authors around the world, and we involved 8 different countries, as you can see here. This paper has been published in the 2019 with great success. This was the key points that we wanted to establish till the beginning. The identification of the infection site, it's very important. You need to localize where the infection is seated. How to avoid contamination during the sampling. How to increase the reliability of your diagnosis, and especially how to avoid the false negative as well as the false positives. Looking at this particular aim, we finally try to establish 10 different golden rules from 1 to 10, just to avoid any mistakes and just to avoid any different rule and to establish the same rule around the world. Let's see what are these type of rules that any orthopedics and any microbiologist must follow for any diagnosis. The first is this: do not use swabs. As you can see in this cartoon, you can see that this surgeon collected very huge amount of samples. In this situation, for sure, you can increase the reliability, you can increase your positivity of your bag, you can catch the bag, but at the same time, the risk is to contaminate and to collect other microbes around the site of infection, and so the number of false positive can be very high. The second rule is please collect the right number of samples. The samples can be explanted biomaterials, synovial fluid, periprosthetic tissue, what you want, but not more than 6 or 7. Because if you increase your ability to collect sample, again, as this surgeon done many years ago, collecting 18 different samples, of course you increase the cost of your diagnosis, but at the same time you increase also the false positivity and the rate of contamination. 4 points are very relevant. The point 3 regarding the behavior of the orthopedic, how to avoid sample contamination. Of course, the orthopedic needs to use clean gloves, sterile instrumentation, need to avoid any contact with the skin of the patient at any time. But the point 4, 5, and 6 are very, very relevant just to avoid the number of false positive or false negatives as well. So it's really important when you collect samples that you must use closed and especially sterile transportation systems for any samples. Of course, the laboratories need to use certified procedural methodology, and they have to explain how to avoid false positive or how to avoid false negatives as well. But the point 6 is very, very important. How to use antibiofilm techniques for the explanted materials, but also for biopsies, because as you know, many microorganisms are inside, are very, very adhered to the tissue, to the biomaterials, and it's really difficult to detach these bacteria to be released and to be detected at the same time. We have a different, at this regard, we have a different situation. One is the sonication. The sonication can be used only for explanted, for solid materials, and not for biopsies, for instance. And this is a very important limit. But the problem is of the sonication are the risk of contamination. More bags or more tube you use, and much more will be the risk of contamination during the handling from the surgery room to the lab. So the means is that probably if you use a huge amount of bag and tube and so on, the risk of false positive is very, very high. Another situation is the time consuming. Per sample, per patient, and per sample, in general, you spend around 1 hour and a half or 2 hours in the best conditions. That's why around the world, and especially we in Italy, we use this particular closed system serving for the collection, for the transportation, and at the same time, which is more important, to detach the microorganisms on the biofilm, on the biomaterial, on the tissue by use chemical compound called DTT, dithiotretol. A compound is a chemical compound able to disgregate the biofilm, and release many, many bacteria. So another point very relevant is the incubation time of the culture. As you can see in this elegant study performed in the USA, you can see here that prolonging the incubation of the culture till 14 days, you can increase your reliability till 90%. So we are sure to identify in such cases aerobics, anaerobics, and also the so-called low-grade microorganisms. Point 8 is very relevant, especially if we look the increasing of the antibiotic resistance. Any lab must use some guidelines, which are these, the EUCAST guidelines, and any lab must report the minimal inhibitory concentration in the report. Any lab must identify the proper antibiotic panel on the basis of the own resistance, regional resistance, or the country resistance. We need to use at least one antibiotic per class. And on the basis of the resistance you have in your country, it's necessary to use maybe much more than antibiotics per class. The two last points are very, very important and are very relevant, especially for the future. The point 9 is the using the molecular method and especially the next generation systems. I believe that these systems need to be improved for now and need to be certified as well. Of course, they increase the sensibility, but at the same time, we need to be sure that we have collected the right sample without any contaminants. Otherwise, you increase again the number of false positives. Of course, any lab or your lab must use a standardized reporting policy, which include also an agreement with the clinician, in this case with the orthopedic. So in conclusion, I think that we need to follow some next steps that would be the future. As first step, we need to rearrange the number of samples of the basis of clinical stage. For instance, in the acute stage, we can use 3 samples, 4 samples. But in chronic stage of infection, we need to use many samples. And in low-grade infections, for instance, we need to use many, many samples. As second point, in the future, we need to perform for the future strict procedures for collection and the sample transportation. This is a really very, very huge bias in the identification of the microbes. As last, we need to improve, of course, the use routinely of the molecular test, but not without we have performed procedures for collection and for sample transportation to avoid, again, contamination. Thank you so much for your attention.